Good afternoon, everyone. My name is Kim Mazeros, and I'm the Ergonomics Research Coordinator at CRE-MSD. And on behalf of our director, Dr. Jack Callahan, I would like to thank you for joining us today. We're pleased to welcome you to this Client-Patient Handling Community of Practice webinar on preventing barriers and facilitating safe patient handling, slide sheet use. We would like to begin by acknowledging the Ministry of Labor, Immigration, Training, and Skills Development for their funding, which supports the delivery of these webinars, as well as our presenters for sharing their expertise. Before we begin, I'd like to go over a few administrative details for the webinar. This webinar is being recorded, and a link to the recording will be provided along with the presentation slides shortly after today's session. Today's webinar format will consist of the presentation, followed by 10 to 15 minutes for question and answers with our presenters. Please enter your questions into the Q&A feature, and I will relay those questions to our presenters, combining similar questions where appropriate. If you do experience any technical issues during the webinar, please send us a message in the chat feature. Following the webinar, you will receive a link to an evaluation survey. One of our key measures is understanding the impact of our webinars, so we greatly appreciate you taking a few minutes to complete this short survey. Also, if you're not already part of our community of practice for client-patient handling, we would like you to join by following the Join the Community of Practice link on the CRE-MSD website. Just head to the homepage and look under the navigation menu for Communities of Practice. In today's webinar, we have three presenters, and it's my pleasure to introduce Pam Hopwood, the lead researcher on this CRE-MSD funded project. Pam Hopwood is a PhD candidate at the University of Waterloo and a research associate at VHA Home Healthcare, as well as a former Canadian Institute of Health Research, CIHR, Health System Impact Fellow. Her work as a qualitative researcher focuses on work and health, precarious work, and health and social systems policy, with particular emphasis on the experiences of personal support workers. Now, over to you, Pam.
Okay, thanks so much. So I'm pleased to be here today to present this webinar titled Preventing Barriers and Facilitating Safe Patient Handling, Slide Sheet Use. There were several partners involved in the conduct of this research, and that includes Nucleus Living, which is part of the Regional Learning Center, March of Dimes Canada, and VHA Home Healthcare, and the University of Waterloo, as well as the Center of Research Expertise for the Prevention of Musculoskeletal Disorders. The research team involved in this study includes myself as the primary investigator, my academic supervisor and co-investigator, Dr. Ellen McKecken, Dr. Emily King, co-investigator and supervisor at VHA Home Healthcare, Taryn Bolt, co-investigator and Regional Learning Center director, Catherine Brookman, co-investigator from CRE-MSD, Community of Practice, and Taronish Kotwall, a research assistant at the University of Waterloo. The aim of this study was to investigate why personal support workers are still not using sliding sheets when they are theoretically available. The study came about as a result of an email from a community of practice member who provides training for PSW organizations on safe lift and transfer techniques and the use of equipment. Their concern was that even after training and when equipment is specifically available and specifically slide sheets, they're not being used. Hence, after discussions with CRE-MSD and VHA Home Healthcare, a PSW provider organization and member of the Community of Practice leadership team, it was agreed this would be an important research study to assist community support organizations in general by investigating what are the barriers for PSWs to use slider sheets even after they've been trained to do so. The March of Dimes, a community support service organization who has many PSWs trained in this regard, was approached to see if they would participate in this research project. I'd now like to introduce Yalini, Yalini Gunarajan is a registered nurse and a regional manager with the Regional Learning Center Division of Nucleus Independent Living. Yalini, over to you.
Thank you, Pam. Great. So I'm going to start off with what is a slide sheet. So a slide sheet is a low friction manual handling tool. It's used to reposition or transfer a patient safely while reducing skin shearing, discomfort, and injury to both the patient and the staff member. It's not the same thing as an incontinence product or bed pad or soaker pad, because those are used to absorb bodily or other fluids and keep the skin, clothing, and bed dry. So a slide sheet is made from slippery synthetic material like nylon or polyester that's often coated with silicone or some sort of material to reduce friction and help with sliding. So we'll go on to the next slide. Here we have a few images of different types of slide sheets. And so there's a variety available. Some stay under the client, some must be placed when we're using it. So the blue slide sheet in the first image here, that's the ergo slide. These are two pieces. It's helpful for moving someone up or down in bed and also side to side. It cannot stay under the patient. The second one here is the Swift slide sheet, and it's got a bottom fitted sheet as well. This one can stay on the bed with the patient on top. Then we have the third image here, which is a continuous loop. It's also the other blue sheet, and it's an ergo slide that's helpful for moving someone up or down in bed. Again, this one cannot stay under the person. And then the last image is the Wendylet slide sheet. It's got sort of four ways it can stay on the bed and be used with fitted bottom sheet. It also has handles which can be attached to mechanical lifts or mechanical assistance for rolling the client as well. In our next slide, we have the cost of recommended slide sheets. So this slide sheets available on sites like Amazon or other sources are generally not the ones recommended for use, as the alternatives supplied through medical organizations have typically been tested and are supported by stronger evidence and research. So it's very important to be mindful of where you're sourcing the products from and to balance kind of risk with clinical appropriateness, product quality, and client and staff safety. So I'll pass it back to Pam and we'll move forward.
Thanks very much, Yalini. I'm now going to pass things over to Taronish Kotwall. Taronish is a Master of Science student at the University of Waterloo, and she worked as a research assistant on this study about safer lifts and transfers. Over to you, Taronish.
Thank you, Pam. So to briefly mention again, when repositioning or transferring a patient in bed, the type of material that PSWs use can make a significant difference in the physical strain that is placed on them. Slide sheets are essentially the most effective and require lower physical effort other than non-sliding materials such as soaker pads or standard cotton draw sheets. Non-sliding materials create a high level of friction between the patient's body and the bed surface, causing PSWs to apply extra force to move the patient. For most patient lifting tasks, the recommendation is to lift a maximum of 35 pounds. Slide sheets, when used appropriately, do exactly that. Using slide sheets or friction-reducing sheets can reduce the stress on hands, wrists, the shoulders, and the lower back of PSWs when moving patients. Using slide sheets is not just a matter of convenience, but it is an important injury prevention strategy to protect both PSWs and the patients. PSWs receive an annual training on safe patient handling techniques, including the proper use of slide sheets. These trainings emphasize injury prevention, body mechanics, and the importance of reducing physical body strain during these repositioning tasks. In addition, many healthcare organizations also have formal policies stating that staff should not manually lift more than 40 pounds. This guideline is in place because repetitive lifting above this threshold significantly increases the risk of musculoskeletal disorders. So, on paper, the system is clear that staff are trained and the equipment is available, and policies exist that limit heavy lifting. So, then why are PSWs still using soaker pads and draw sheets instead of sliding sheets to transfer patients? For this project, we gathered perspectives directly from the field. We first spoke with PSWs working in home and community care settings to better understand their real world practices when repositioning, lifting, and transferring clients in the bed. In addition to PSWs, we then spoke to supervisors and managers for their insights. Importantly, this project underwent ethical review where participation was voluntary and all the information that was collected was confidential as well. We first spoke with PSWs because they wanted to understand their day-to-day care. Rather than relying only on policy documents or training materials, we wanted to hear about what happens during each visit to the client, what tools are used, how decisions are made in the moment, and what challenges the PSWs face. We invited March of Dimes PSWs who work in home and community or supportive housing to participate. In July 2025, we conducted one-on-one interviews with 8 PSWs, all of those who contacted us. From this, we primarily noted that all PSWs had received training in which they talk about using slide sheets, the benefits of using slide sheets for injury reduction, and the disadvantages of using a soaker pad for repositioning clients. Following the PSW's interviews, we invited supervisors and managers to also speak with us. Their insights helped us understand the organizational perspective, the policies around slide sheet use, and the equipment availability. Their insights acted as a knowledge check as they confirmed PSW's data. We held a focus group of 5 supervisors and managers. So, by including both the frontline staff and the leadership personnel, we were able to capture a complete picture of current practices and potential gaps between the policy and the implementation. All PSWs who were invited to participate in the interviews were required to complete their annual training. PSWs varied from those with 5 or less to almost 30 years of experience working as a PSW, either in supportive or in community. And all PSWs are given pseudonyms. In the focus group of supervisors and managers from March of Dimes, all participants have substantial experience ranging from 10 to 30 years working in healthcare and in leadership roles. And all these participants were also given pseudonyms. Thank you.
Oh, Pam, you're muted.
Thank you. Thank you, Taronish. So to begin with, we want to iterate that procuring slide sheets is actually the client responsibility. Organizations such as the March of Dimes are not funded to provide equipment. Mina spoke about the cost and the onus being on the client to procure sliding sheets. She suggested it's a lot of work to get the funding and ask for these kind of things. And this is a quote from Mina, who worked in supportive housing. Next, we have a quote from Nolwazi, who also worked in community. And she said the draw sheet, which they used to call a soaker pad, which she had mixed up, they sleep on it for incontinence. So you can use that to reposition. So one of the first things we found was that workers often used soaker pads instead of slide sheets for repositioning clients, even though slide sheets reduce the strain on workers and reduce the risk for clients' skin integrity. This is because the incontinence product is already beneath the client. And even though PSWs have been trained, there's a gap in what their practice is. People tend to make rational choices in the circumstances they find themselves in. The gap between education and practice versus what people actually do in their day-to-day. Sliding sheets may also not be available for reasons we'll get into later. This quote is from Abina in support of housing. And she spoke about the blue slippery one when referring to soaker pads and draw sheets. So there were different terms used to describe soaker pads. They were also called draw sheets. However, they differ from slider sheets. The name of slider sheets was not clear to all PSWs. Obviously, despite the training that all workers had received about slide sheets, they were not familiar with what sliding sheets were. There was clearly confusion about what we were talking about. Sandra spoke about one client who needed a sling and a mechanical lift for repositioning in bed. However, she worked in a retirement home where she was reliant on retirement home staff to come and be a second person. Sometimes she had to use a soaker pad to move her client because the other PSW did not have time for using the sling. So again, we see a gap between what best practice is and what the reality is on the ground. Sometimes waiting for a second person was a barrier to using proper equipment. When safety and policy come into conflict, it can be hard for PSWs to stand up for what is right. Keisha, a supportive housing PSW, spoke about how some clients did not need slider sheets because they were able to help reposition themselves. However, it's always important to review the client's ability to help determine what process and equipment are required on an ongoing basis. So Keisha said some can hold on to the side rail and adjust themselves. So basically, we don't have a lot of adjusting with them. So sliding sheets work better with two people. March of Dimes sends two people when it needs to be two people for any given task. However, in one retirement home, the retirement home PSW was not always agreeable to assisting with required equipment. One challenge was that clients preferred not to use sliding sheets. Martina, a March of Dimes supervisor, said, "We are an independent living, and some people use the independent living to that point. You know, this is my care. This is the way I want it. And yeah, you just have to go with it." Debbie, another supervisor, echoed that a lot of clients don't want to get away from using the soaker pad. So based on client choice, that's in place quite a bit. Client's preference was also an issue for Sandra in the community. She had a client refuse to get a sliding sheet. This is unfortunate because a sliding sheet is better for PSW's safety when doing the repositioning. So I asked her, have you ever requested a slider sheet for that particular client? And she said yes, when she was living at home before she went to retirement. And what was the response? Sandra said no. It was the client and the spouse's decision. Dahlia said that some clients are resistant to change. And when they come home from hospital or rehab, they have a very instilled sense of how their care should look and what equipment should be in place from them. So to implement some of the changes was very challenging for staff. We discussed some of the solutions, and one of those was increasing client familiarity. One suggestion that came from the supervisor focus group was that sliding sheets could be introduced at hospital or rehab, so the client was familiar with them before being discharged to their home. Solutions for tackling client preference and procurement of sliding sheets also included bringing in a vendor for promotion. This could increase opportunity to frame things in a way that promotes health and safety. Another suggestion that arose from the supervisor focus group was that having occupational therapists available sometimes makes client buy-in easier. There's a true gap in how the system is set up. There's limited funding for the clients to buy sliding sheets. The province will pay organizations to provide the care, but not in the way that makes it safest for workers. Abina spoke about not all clients having sliding sheets because she thought some can't afford them. So again, this is a barrier to procurement of sliding sheets. Thinking of the solutions to cost, when the cost of sliding sheet is a barrier, sometimes occupational therapists or social workers can help clients fill out funding requests. However, there's also been instances in the past where, despite a lack of funding, March of Dimes has been able to find a way to provide a sliding sheet for a client. This is not in the budget of organizations like March of Dimes. Therefore, overall funding through the Ontario Disability Support Program or other programs should be considered. One barrier to using sliding sheets is that PSWs are used to using the soaker pad for incontinence, and that soaker pad is already in place. It's an additional step to put the sliding sheet in place, which could be a barrier for workers. Debbie, a supervisor, said this might be a barrier and the pad's already there, so why not just use that and skip that extra step? Solutions for increasing the use of sliding sheets were provided by the supervisor focus group. They suggested considering sliding sheets that stay beneath an individual. Start training in school for PSWs to learn more about sliding sheets. Have continuing monitoring and training and evaluation in organizations. Talk about it at staff meetings, and perhaps have in-house promotion. Also, having the person doing the in-home safety assessment recommend sliding sheets was seen as important. Additionally, a reminder for PSWs that using sliding sheets is safest for skin integrity. It may be helpful for clients to approach the issue from a health and safety standpoint and remind them that the sliding sheet saves PSWs' backs. Overall, we found several barriers to sliding sheet use, with supervisors making some practical and feasible recommendations to overcome these barriers. To recap, first, a sliding sheet must be right for the job, and the client must be willing to use one. Supervisors suggested that sliding sheets use could begin in rehab. Also, having OTs recommend sliding sheets might help encourage client buy-in. Second, slide sheets have to be available. Applying for funding was one suggestion. However, an increase to existing funding could help, such as increasing ODSP. Training to use slide sheets is provided for PSWs on an annual basis. Managers recommended they could also implement individual training for clients in need of slider sheets. Ongoing training and evaluation and monitoring of PSW practices could also help reinforce that annual training. For the aspect of overcoming convenience, such as when PSWs use soaker pads instead of sliding sheets, regular training was again suggested. Having PSWs using sliding sheets in school was also recommended. So overall, there are ongoing challenges in Ontario when it comes to normalizing the practice of using sliding sheets. Today, we want to turn the discussion over to you to see if you have additional recommendations or success stories about sliding sheet use. So at this time, we'll open the floor to comments and questions. And for more information about this research project, you can contact myself. My email is on the screen, or for information about the client-patient handling community of practice, contact Catherine Brookman, also at the University of Waterloo. Thank you.
Thank you. Thank you so much, Pam. And thank you, Yalini and Taronish, for your contributions as well. That was a fantastic overview of the project. So, as Pam mentioned, at this point, we'll be taking questions from the Q&A feature. And if you see any questions that you would also like answered that other participants had asked, please vote on these questions and that can help us prioritize. So I'm going to just turn it over to the chat just a minute. Okay, don't be shy. There's no questions in the chat, but I do have one question that I have for you, Pam, if you are willing to take mine. So I'm just wondering, should slide sheets be used with all patient populations, or are there any recommendations or studies informing when they're effective to reduce MSD risk and maybe when they're not sufficient in reducing forces enough to reduce risk?
Mm-hmm. Yeah, so no, slide sheets are definitely a client by client basis, and that decision should be made by the occupational therapist or the person going in to assess the client needs, mainly for people who need repositioning,
Okay,
whether that person is lightweight or heavier, the slide sheet can be particularly beneficial.
great.
If the need is more, then something like a sling with an overhead lift would be recommended.
Great. Thank you for that clarification. Now we have some questions coming through. Okay, so we'll start with the first question here. Sorry, I'm not sure if you mentioned this in the webinar. Are you recommending slider sheets to be taken off of the bed after usage, or can the slider sheet be left in bed?
It depends on the slider sheet. So as Yalini demonstrated with the first, I'll go back to that slide. There are several types of slider sheet. So some of them are designed to stay under the client. And these are particularly the ones that have a fitted bed sheet. And some of them are designed to be placed each time. So it really depends on the sliding sheet.
Okay, that's good to know. Okay, the second question here, was there consideration to provide the PSWs with their own personal issued slider sheet as PPE?
That's a fantastic question. And unfortunately, when it comes to infection prevention and control, it's not able to, organizations are not able to authorize the use of the same equipment from patient to patient. So even with a sling or an incontinence pad, it's not possible for these home nurses to wash and sanitize between every patient.
Yeah, that makes sense. Why are supervisors and clients dictating PSW safety by refusing the use of sliding sheets? Can sliding sheets become mandatory to help prevent MSD for PSWs?
That's a fantastic question. And I asked that of the supervisors, is there any way that you could mandate that this is the safest for our worker population? So we need you, if you need this motion or transfer in bed, this type of activity, we need you to agree to slide sheet use. And attention really comes between the patient's individual rights of choice, and that comes into conflict sometimes with what is best for the worker in terms of their occupational health and safety. And I don't know that all organizations have made decisions on how that falls.
Definitely a difficult consideration. Okay. Some workers' compensation systems offer grants for purchasing safety equipment. Is this a possibility in Canada? And this comes from one of our colleagues in the United States.
That's really interesting. I hadn't thought of workers' compensation systems as a possibility for a funding source.
Actually, I can provide some insight into Ontario's systems. So I know WSIB has a health and safety excellence program that potentially, like if an organization is registered with the program, they can do certain control of hazards topics and pick different areas where they can, if they can demonstrate that they've implemented these things in their organization, they are eligible for rebates. So there is maybe a system within Ontario that can be leveraged.
Interesting.
Okay, so the next question. We did a pilot with Arjo slide tubes, and I'm sorry if I'm not pronouncing that correctly. They are wipeable, so could be provided to community workers and not left with a specific client. There was lots of positive feedback from the workers. However, we found that more and more clients were buying their own.
That's really fantastic.
Thank you
We'll
for
have to
that.
add Arjo to the list of potential providers.
Awesome. All right. Were there any issues with slide sheet use and the client's skin integrity or other skin conditions?
We didn't hear from PSWs. Again, many of them weren't familiar with slide sheets or weren't using them. So we didn't hear from them that there had been any issues with slide sheets and skin integrity. However, there was the comment that some clients didn't like the sound of slide sheets underneath them. So they didn't like them being left underneath them.
Okay. Interesting. Next question here. What if a client is on the slide sheet and then they like to use the upright position on their bed? Will this create an issue for them sliding downward on the bed?
Right. So some of these are the ones that are not left in place obviously would be used once to move the client up and then would be removed so the client doesn't slide back down. The other ones, the friction can be can go in one direction, the anti-slip, so the other way wouldn't be quite as slippery. But again, it would have to be tested what was appropriate for each client.
Great, thank you. Based on your response to the question from Kim, do you think education for occupational therapists who are recommending specific equipment for clients would be beneficial?
Yes, I do. Yeah. Yeah, for clients, for going out and seeing what clients need and also working with clients to educate them on what's best for workers' health and safety. I think OTs could play a really big advocacy role in there for helping clients understand the benefits.
Yeah, I agree. Okay, can you provide additional information about the products that can be left under the patient?
I'll turn that over to Yalini.
Yes. So the one that can be left under the patient is the second one pictured here, the Swift, and Swift is an organization that provides this particular slide sheet. So I'm not sure if we can send out a link or anything like that. We haven't necessarily, I can't endorse, or we haven't necessarily full out tried out these with clients and have kind of a evidence base on that. That's probably lies with Swift, but certainly is something that we can maybe provide a resource after the webinar.
Wonderful. Definitely we can tie back in the email response with the webinar recording link, and we can provide those names and links to those companies if that's okay. Okay, next question here. Are there any good training resources or videos on slider sheet use that you can recommend?
I'm not familiar with any specifically, but again, Yalini at the Regional Learning Center may have access to some of those. I know they do training with PSWs annually, although they do find the hands-on practice is most effective.
I can speak to that quickly. So we do have mostly hands-on education that we provide, like Pam said, directly for the staff, where we, show and try different slide sheets that can be used and how to use it with the correct body mechanics and things like that. And then we have found some videos to be useful, but sometimes when we're using external videos, there might be some things that are either done incorrectly or it's not always accurate. So we do have to be mindful of how those videos are made and kind of the evidence-based pieces behind that. So I don't have necessarily specific ones I would recommend, but just being mindful of how they're being used when you're watching those videos.
Great. Thank you for that context, Yalini. Do you know of any product that can be used as both a slider sheet and a sling? That would be a very efficient product if it does exist.
I'm not familiar with anything like that, no.
The last one pictured, the Levitt version, there is some use for it on a mechanical lift. We are actually waiting to get a demo on that as well to see how that would work. But that's as far as my knowledge goes with the ones that are sort of a mix of both. But that would be very nice, and a bit of both worlds would be very helpful.
Great. Thanks for that, Yalini. Okay, just more of a comment on this next one. I've been involved in safe patient handling training for PSWs. They often appear to have very little knowledge of assistive devices that are available and do not have a very robust annual training. There seems to be a very limited amount of providers that are available to give such training. Can anyone comment on that experience?
I know with the Regional Learning Center, they do have a regular program that different organizations take advantage of. And I've attended their safe lifts and handling training, and it seems to be quite robust. But whether other organizations do that the same way or have maybe online training instead of in person, I'm not sure.
Okay. And feel free as a participant, if you do want to weigh in on this and comment. Once I've answered the question in the Q&A, you can leave comments on it and provide more details if you would like to.
I just would like to add a little bit of context as well for that last question. So yes, we do provide education and for it's hands-on, so it's in person. So that's always nice for staff to come and be able to practice that piece. But sometimes it's very much organization specific. So that's how we end up missing some of the staff in the regions and things like that, where maybe perhaps they're not receiving the annual education. And then I just wanted to clarify, I think when I spoke about the last image here, I said the Levitt slide sheet. It's actually called the Wendy Lett slide sheet. Okay, so I wanted to get the brand name correct.
Great. And Yalini, if you do have a chance, maybe if you can go into the answered section of the Q&A and just put in, if you have the company names and links readily available, we can include those right now.
Sure, sounds good.
Thank you. Okay, a few more questions coming up here. Are there tools, training, review for occupational therapists to maintain their knowledge on products and their criteria on what to select for the client?
That is beyond the scope of my knowledge, but I wonder if that's something that if there's a college of occupational therapists, there might be some opportunity there for dissemination of information.
Definitely, yeah. And if there is any occupational therapists on the call right now, I'm going to put this question in the answered section, and please feel free to comment on that. Okay. Is there any additional research being conducted on slider sheet use following this project? Maybe a partnership with other government entities like WSIB, Ministry of LTC, Ministry MLITSD, so Ministry of Labor. This could be helpful in pushing for change potentially.
Mm. Yes, we haven't really gotten to next steps yet. We're still kind of tallying our results and figuring out how we're going to share our knowledge about what we've learned from this experience. But there's certainly room in the future to explore further with other government entities and see what possibilities can be put into place that really take and encompass that concern for workers' occupational health and safety.
For sure.
Especially when it's in tension with clients' rights.
Mm-hmm. And a follow-up to that question, is there any prospect of doing similar research in a hospital setting specifically?
Interesting question. I'm not sure what what that would look like. I could see it certainly somewhere like a rehab hospital where the frequency of use for repositioning clients, particularly learning what clients are discharged home with in the terms of their plans and equipment, and understanding that education and the transition to home and how that affects their choices.
For sure. Is the annual PSW training provided internally by the March of Dimes, and how many PSWs are there?
I'll let Yalini answer that.
Yeah, so we have trained MOD staff for over, I want to say, I think this is our fourth year, and we do safer lifts and transfers. That's the name of our session, and it is done annually. It's about a 3-hour session. They come in, they get some theory, and then they do the hands-on practice as well.
Great. And how many PSWs
Oh, yes.
are there?
I believe we train about over 200.
Oh, wow. That's a large group. Great. Thank you for that. Okay, and I'm just going to leave the question and answer open for the next minute. So if you have any other questions that you would like the presenters to address, please feel free to drop them in the question and answer. I'm just going to check the chat very quickly to see if there are any other questions that we had missed. Aha. Has there been an increase in PSW injuries due to moving clients? And if so, what measures have been put in place to address this?
It's really hard to track the number of injuries to PSWs, though we know from workplace WSIB statistics that PSWs and healthcare workers are some of the highest injuries. It's really hard to track lesser injuries that aren't put through as claims because organizations, especially in home and community care, are so dispersed and we don't collect statistics in any comprehensive manner.
Okay, there was just a clarification put in here. They mentioned reported injuries, not like unreported injuries.
Mm.
So was there an increase in reported injuries was the question?
Not to my knowledge.
Okay, thank you. All right, and next question. What type of injuries can occur using a soaker pad versus a slider sheet?
Well, injuries can occur to both the worker and to the client. So using a soaker pad, dragging somebody up and down along a bed can cause bed sores on heels or other vulnerable or fragile skin areas. But for PSWs who are doing that, they're often lifting with more force than they need to. So it can be wrists, shoulders, lower back.
Great, thank you. I'm just noticing a comment in the chat. So there is a College of Ontario Occupational Therapists, an Ontario Association of Occupational Therapists, and a Canadian Association as well. So just following up to that previous question about kind of dissemination. And there are challenges with repositioning patients in acute care settings, and this is frequently reported cause of MSD injury. So thank you for that clarification, Janet. All right. So don't see any more questions in the chat. And I'm not seeing any more questions in the question and answer period. So with that, I just wanted to thank everyone for joining us today. And we look forward to seeing you at our next webinar. And this will be held on June 22nd on Client Handling Program Resources, a Canadian Scan. So you can check our event page on the CRE-MSD website for the list of upcoming webinars. And finally, if you haven't already, we would encourage you to visit our MSD Prevention Guideline for Ontario website at msdprevention.com. Here you'll find a wide range of resources designed to support workplaces. So thank you again to all of our presenters today, and thank you to our participants for an engaging conversation. Have a great day, everyone.